ABC-13 Eyewitness News This Morning starts now.
Summer is here, but before you and your family head to the beach and dive headfirst into vacation mode, which I know some of you already have, I know I have at times, just think about taking some precautions. Summer is the prime season for trips to the emergency room, poison ivy to snake bites, dehydration. Here with information on keeping ourselves safe is Dr. Derrick Mitchell with Spring Central Hospital. Thank you for coming in.
Thanks for having me. Good morning.
Let's talk first about heat exhaustion, because I feel like I am still kind of getting used to how hot it is out there, and it catches me off guard if I stay out too long. When do we first realize maybe that something's going on, that we need to take a break?
Well, one of the first signs or symptoms you're going to get is dizziness, okay? Dry mouth, malaise, which is a fancy term for feeling bad and feeling out of it. A lot of people like to use lethargy, but it's not that bad. It's just kind of feeling out of it after being in the sun for long periods of time, and not even just the sun. It's very humid outside. The heat index is going up. So we're already starting to see people who are in soccer, football, spending a lot of time outdoors, even folks who are in their landscaping mode.
Summer camps, and yeah.
Absolutely, they're coming in, feeling bad, feeling tired and lethargic.
When do you know that it has gone beyond something that you can take care of yourself, that just taking a break in the shade will take care of?
That's a hard question. It's really, we leave it up to the patient. If the patient's not feeling well, they seek help. Especially if they get nauseous or vomiting and they can't hold the water down, that's one of the other signs and symptoms that you'll get with heat exhaustion. Then you're going to get even more dehydrated and you're going to feel worse.
So as a mother of two little ones, I've noticed that summer is a prime time for crazy rashes and bites and things like that to pop up. Whether it just be mosquitoes or a spider or a heat rash, when you take a look at some of the marks that come up, when do you know that, wow, something needs to be looked at by a doctor? Maybe
Sure.
not even an emergency room doctor, but a physician.
Well, some of these, of course, you mentioned bites as a whole scope of things. There's a lot out there, especially mosquito bites. Those are usually going to give you a little bit of irritation, a little bit of itchiness, histamine reaction, kind of allergic reaction. But when things look really bad, very red, okay, very tender. Sometimes if you see pus or yellow fluid underneath the surface,
Red
that's usually
flag.
an ominous sign, yes. As well as a rapidly expanding mass or lesion. Those things you shouldn't wait till the next day because they can rapidly progress. So definitely and if you're unsure, just go in, because it's horrible when someone waits a little too long and then you see it 2 or 3 days later and it could be widespread. So,
What are some of the most common mistakes that people make that they end up in your ER for?
Common mistakes. Poking a snake.
Something like that, right?
I saw the segment you had the other day where the guy saw a snake underneath the hood of a car, the snake seeking high ground. And there's no one thing. Patients are intelligent. We have online resources. This is a wonderful time in our history where you're able to get information online. So, if they have a question, they come in and we take care of them.
Excellent. Thank you, Dr. Derrick Mitchell, for coming in this morning. I appreciate it.
Okay,
protecting us from those summer mishaps. We appreciate it.
Absolutely. Thank you. Thanks for having me this morning.
Sure. Still to come here on Eyewitness News and Sports.